Good day everyone! I am Durly Pico Catano from BSN 12A, and for this video, I am going to perform 3 return demonstration procedures, including hand washing, glove donning and doffing, and Leopold's maneuver. So I am going to start by performing hand washing. So first things first, why is hand washing important? So hand washing is a process of removing dirt and bacteria with the use of soap as well as water that rinse them off. So this is important as this prevents the spread of infections as well as contaminants and disease-causing bacteria. So this is important not just in the healthcare settings but also in our daily life. So first things first, we have to ensure that we have all the necessary materials that we need, and I have here a running water, the liquid soap, a paper towel, as well as easily reachable sink. So now, stand in front of the sink and always remember that our uniform should not be touching the sink because sink is a highly contaminated area and touching it will allow the transfer for the bacteria to our uniform. So if any, you have to remove the jewelries that you have because jewelries are one of the things that bacteria clog in, and by removing them, we eliminate the potential source of bacteria and thus allow for an effective hand cleaning. Now turn on the faucet and adjust the water. So by adjusting the water, we allow for a much controllable and steady, manageable flow of the water, which is important so that we can properly rinse and cleanse our hands. Okay, so wet the hands thoroughly, starting from the wrist area to the fingers, with our fingers pointing toward the sink. Okay. Now that our hands are wet, we have to elevate our hands just above the elbow to ensure that now the water flows from the least to the most contaminated area of our hands. Okay, and then inspect for the presence of lesions, cuts, and abrasions to identify the entry points of bacteria which may harbor pathogens and may cause contaminations and infections. Okay, there's no cuts, abrasions, and the likes. Okay, now apply an ample amount of soap on your hand and lather hands thoroughly to properly loosen dirts, oils, and microbes. I'm going to do this for 10 to 15 seconds to ensure firm rubbing and also to ensure that all areas of my hands will be covered. Alright, now rub the palm using the back of our hands with our fingers interlaced for at least 5 times. So by doing this, we ensure that we can properly clean the area between our fingers and also the back of our hand, which is where bacteria commonly reside. Okay, now rub palm to palm with our fingers interlaced to again ensure that areas between our fingers and the palmar surfaces are properly cleansed. Okay, after that, wash the back or rub the back of our fingers with our fingers interlocked. This is a commonly missed area, so we really have to thoroughly cleanse them. Okay. After that, rub each thumb clasped in the opposite hand in a rotational manner. This is a commonly overlooked area, so we also have to thoroughly wash them. Okay. After that, in a rotational movement backwards and forwards, we are going to rub our left palm using the clasped fingers of our right hand. So this ensures that we can eliminate the accumulated dirts and bacteria that are inside or underneath the fingernails as well as the fingertips. Alright. Now for the last step, wash the wrist on rotational movement. Okay, bacteria also reach this point, so we have to thoroughly wash them. Okay. Now that we are done with the firm rubbing and lathering, we are now going to rinse the soap with the running water. So again, our hands should be above the elbows. Okay, so this eliminates soaps and remaining microorganisms. Alright, after that, inspect for the presence of remaining soaps and dirt to ensure that they are not left on the hands, because they may cause infections as well as contamination. And if present, then we have to rinse again. Alright. Okay, now that we are done rinsing, we are going to use a clean and dry paper towel to clean our hands thoroughly. So this is very important because bacteria thrives best in wet areas. Hence, we have to thoroughly dry our hands. And remember that we're going from our fingers to fingers downwards, or from the least to the most contaminated area. And also, we have to prevent reusing paper towel to avoid recontamination. Okay, one last. Okay, now to turn off the faucet, use a clean, dry paper towel to avoid touching the faucet, because the faucet is a highly contaminated area and we have to prevent touching it, because if we do, then we have to redo the procedure all over again. Okay, so that will be it for my hand washing return demonstration. Now let us move on to glove donning and doffing. Alright, now for this part of the video, I am going to perform glove donning and doffing return demonstration. So gloving is important as this creates a protective barrier between the skin and potential contaminants and prevents the transmission of infectious agents between healthcare provider and the patients. Okay, so for the first step, perform hand washing. Remember that gloving does not replace hand washing, and following the proper steps of hand washing removes transient microorganisms and thus reduces the risk of contamination in case of glove tears or improper removal. Now that we have done proper hand washing, prepare the gloves by checking its size. So the size of the glove must be fit to the user to maintain dexterity and comfort. And also inspect for any stains or any tears, because if present, this may indicate that the glove has been opened and contaminated. Okay, I don't see any stains and any tears. Alright, now remove the outer package by peeling apart its sides. Be careful to not accidentally drop the inner package. Okay, grab the inner package and place it on a dry, flat, and waist level area. So this prevents contamination because bacteria thrive best in wet areas, and anything below the waist level is considered to be contaminated. Open the inner packaging, touching only the folded parts of the glove to prevent touching the sterile surface or area of the package. Now identify where the right and the left glove is to allow easier wearing of the glove, and also see and observe that both gloves has cuff of about 5 centimeters. So this is important to bear in mind, as this allowed us to be cautious on what parts of the glove we are only allowed to touch. Now I'm going to glove my dominant hand first to enhance control and position when gloving my non-dominant hand. And I'm going to do that by grasping the cuff edge of the dominant glove using my thumb and first 2 fingers. And remember that we are going to touch only the inside part of the cuff. Okay, and insert the fingers and hands and carefully slide them in. Remember not to touch any part of the outside glove, and pull it over completely and leave the cuff, ensuring that it does not roll up to waist, and also ensure that the thumb and the rest of the fingers are on the right places. This is so that we can properly carry out the procedure that we will be doing later, and to also avoid any interruptions or distractions. Now I'm going to wear my non-dominant glove by placing my dominant fingers underneath the cuff of the non-dominant hand. Okay, so now I am having a sterile to sterile contact, and by doing this I am going to abduct my thumbs back so that I don't accidentally touch my wrist area, which is an exposed area, to prevent contamination. Okay, now slide the fingers in. Alright. Okay. Again, be careful not to touch the glove with any parts of your exposed skin to prevent contamination. And now that we have both of the gloves on, we can reposition the gloves to ensure comfort while using it. Alright. After that, ensure that your hands are together, away from the body and above the waist level, to prevent from accidentally swaying our gloved hand anywhere that is contaminated. Okay, so now that I'm done with the glove donning, I'm going to perform glove doffing. So I'm going to take off my dominant hand's glove first by grasping the cuff. So assuming that we have already used the glove and touched any bodily fluids or contaminants, we have to really be cautious not to touch the glove with our exposed skin. Okay, and pull it over completely, turning it inside out. By turning it inside out, we ensure that any body fluids or any residues or contaminants that we touched with our glove remains inside. So this prevents spillage of what has been touched with the glove. Okay. Now using the fingers of my dominant ungloved hand, I'm going to place it underneath the cuff, inside the cuff of my gloves, and pull it over. Okay. Be cautious that your exposed skin does not touch the outside part of the glove. Now we're going to discard this to the proper disposal to prevent any accidents. Alright. Now to end the procedure, perform hand washing to maintain cleanliness and safetyness of all. So now let us move on to Leopold's Leopold's maneuver return demonstration. Alright, now we're on the last part of this video, and I am going to be showing you the Leopold's maneuver. So healthcare providers use a set of abdominal palpation method called the Leopold's maneuver. This is to evaluate the fetal presentation, engagement, as well as position in the uterus. So this helps the healthcare providers make a well-informed decision for pregnancy and childbirth, and also allow them to offer information about the fetal orientation. So the first thing that we need to do is perform hand washing. Performing hand washing eliminates the spread of bacteria, infections, and contamination, and thus maintain hygienic practices. Now that we are done with hand washing, I am going to introduce myself as well as verify the client. So this helps build rapport with the client and also ensure that the assessment that we will be doing will be done in the correct patient. After that, we're going to explain the procedure to the patient to gain cooperation, reduce anxiety, and also ensure informed consent. Okay, so ma'am, for this morning, I am going to perform the Leopold's maneuver. Here, I am going to palpate your abdominal area for us to determine the position of your baby. So this will help us understand how your baby is doing. So would that be alright with you? Do you have any questions before we begin? Okay. So let the client empty their bladder before the procedure. Ma'am, I encourage you to empty your bladder or to void before we begin this procedure po. So this provide comfort as well as accuracy by eliminating or by avoiding bladder interference. Okay. After that is to position the client in supine with knees slightly flexed, and also place a pillow underneath the client's head. Okay, so excuse me po, let me just place a pillow under your head. This provides comfort as well as optimal abdominal relaxation for effective palpation. Are you comfortable with your position po? Okay, so if you are right-handed, stand and face the client's right side. This allows for better control and precision when palpating. Okay, now we're going to start po. Let me just pull down this one. Okay, so expose only the areas to be assessed. Now we're going to do first the Leopold's first maneuver, which is also known as the fundal grip. So here, face and palpate the client's uterine fundus. This is to determine what part of the fetus lies in the upper part of the uterus. So ma'am, I'm going to start palpating you po. Palpate gently but firmly. And also note for the shape, consistency, and the mobility. Because here we are determining or we are assessing for the fetal pole, which is either head or bridge. So if head, then that would feel hard, round, and moves independently. And if bridge, then that would feel softer and nodular. Okay, now palpate in a downward direction to determine the position of the fetal extremities, back, and anterior shoulder. So again, we're going to palpate gently but firmly. And for this one, I am going to keep my left hand stationed while my other hand palpate. But I am going to do the same technique with the opposite hand after this. This assesses the position and orientation of the fetus. So the back would feel smooth but firm, as well as broad and continuous, while the fetal extremity would feel irregular and knobby. Okay, now for the Leopold's third maneuver, I'm going to place one hand over the symphysis pubis and grasp the lower uterine segment between my thumb and my finger. So I'm going to make an opposite L here to assess if engagement has already occurred or not. This is also called as the Polwick's grip. Okay, I'm going to move my hand, and if it moves with the hand, that means that engagement has not occurred yet. This is also termed as floating. But if it is immovable, that means that engagement has already occurred. Alright, now for the fourth Leopold's maneuver, also known as the pubic, which also known as the pelvic grip, we are going to turn and face the client's feet. So here we are verifying the findings of the third maneuver, as well as determining the flexion of the vertex. Okay, we're going to palpate downwards. Okay, here we are assessing the descent as well as the attitude of the presenting part. So that would be either flexed or extended. So if the cephalic prominence is of the same side as the fetal extremity, then the head is flexed. But if the prominence is of the same side as the back, then the head would be extended. Okay, after that, we are now going to locate again the fetal back and place the stethoscope over that area to listen for the fetal heart rate for the full minute. So us locating for the fetal back is important because the fetal back is where we can properly hear the fetal heart rate. So this allows for accurate detection of the heart rate. Okay, so ma'am, you're done with the assessment. Let me just hold this up to prevent you from being cold. And after that, note the rate, the location, as well as the characteristic of the fetal heart rate. Okay, so by noting this, we are ensuring that we leave a record for the information of the fetal well-being and viability. Okay, now make the patient comfortable. Okay. Are you comfortable with your position po? Alright, so this shows concern for patient welfare as well as promote recovery and relaxation post-assessment. Okay, so ma'am, I would just like to inform you that after our assessment, I have observed that your baby is positioned on your right side and in cephalic prominence. So that means that the head of your baby is positioned on your lower uterus. And also your baby's heart rate is at 130 beats per minute, which is in the normal range. So do you have any questions or concerns with that? Alright, so that ends our assessment. Well, thank you so much for your cooperation. Okay, Now, after the procedure, ensure to document the observations made, which includes the presentation position, the attitude, and whether engaged or not. So this ensures continuity of care and also ensure that there will be an accurate record for clinical decision making. So that ends this return demonstration. Thank you so much for listening.